And welcome everyone to the Real Leaders Podcast. I am your host, Kevin Edwards. Alongside us today, we have Dr. Rafael Grossmann. Doc, thanks for being with us today.
My pleasure.
So Doc, from everyone I've talked to at the Exponential Medicine community, your work seems to be something of legend. Could you explain to our audience a little bit about your background and then what I want to get into, this device that we have in front of us?
Sure. Thank you again for having me here. I'm a general surgeon. I do general surgery and trauma surgery. Half of what I do is emergency and half of what I do is elective. I do advanced laparoscopy and robotics. That's my full-time job in a way. I'm originally from Venezuela. I'm an immigrant, I guess, in the U.S. My training for med school was in Venezuela. My training for surgery was in Ann Arbor, Michigan, here in the States. And I have been, for the last maybe 15 years or so, trying to engage with how technology, used in a smart fashion, can help us really solve the problem that we have, or the problems that we have in healthcare and in the learning and the teaching of healthcare. So that's sort of my main mantra, using the technology in a smart fashion.
So what's been technology's role for a surgeon in this day and age, and how is it incorporated?
Well, everything we do in surgery these days pretty much has a very high level of gadgetry and tech, as you can imagine, from doing the simplest operation sometimes to monitoring the patient to doing robotic surgery. So I've always been a technophile of sorts, and for me it's really not the technology per se, but the use we give to that technology where the magic happens. I think that's very important.
So for surgery specifically though, how are you using technology, and maybe show our audience this device you have in front of us right now?
Well, let's start with education. I think that a lot of this technology, for example, there's a platform that is called Inside Heart, and Inside Heart is basically revolutionizing how we learn and how we teach. Okay, Inside Heart from the company Animaris is a company in Germany, and imagine seeing a 3D hologram that is accurate in the sense of anatomically and physiologically accurate, and instead of learning in a 2D screen or in a paper, you are basically learning in the space. I'm a fan of what we call spatial computing. Spatial computing is sort of the fourth era of computing.
Right.
We started with MS-DOS systems. We went to the graphic user interfaces like the Apple desktop, right, with the icons. And then we went to the touch interface, and then now we are in the spatial computing in the space. The space is the desktop, and you have devices like the Magic Leap, for example, or the HoloLens, or other devices, but mainly the Magic Leap and the HoloLens that allow you to engage with that digital world and interact with it. And I can open my emails in here, I can go to the next room and watch a video in YouTube, or I can go to the next patient room and have the EMR, the electronic medical record, open. So this device is truly, as its name is Magic Leap, is really a leap into a magical sort of universe, almost like a matrix-like universe that allows you to compute and to interact with all those digital data pieces in a way that we could never before. So Magic Leap is integrating, for example, Inside Heart, and you can put the glasses on and you see the heart beating. You can pair that beating with a Apple Watch, for example, and you can see your own heart rate beating in there, and then you can go inside the heart and you can see the blood flowing, and you can see a clot forming, and you can see the clot going to the brain and give you a stroke. So not just for medical education per se, but for, imagine the power of educating patients, educating, changing behaviors, engaging the patient to what the consequence of certain bad behavior is going to be if you can immerse them in the experience. So it's really the potential is unlimited. The only limit is our creativity, our imagination, indeed.
Interesting. Okay, so I want to stick on the point of education. Are what you're finding now, maybe surgeons that are coming to this space, or any doctors that are coming to this space, are they finding it? Are they able to comprehend different techniques through seeing virtual reality and mixed reality and augmented reality?
Absolutely. Again, it's a new way in a form of learning and a new way of teaching. So if you have a younger doctor, let's say you have a younger trainee in surgery, and rather than with the typical saying of you see one, you do one, and you teach one, you can really change how you see one. You can even change how you do one, and even more so, you can change how you teach one. So by immersing someone in a virtual reality world, for example, with a device like Oculus, for example, Oculus Go, and you have the digital OR, and you have the digital patient, and you have the digital anatomy and the digital tools, and then you can do the operation digitally, like the pilots do in a simulator before they go fly a jet full of people, the same way. And you practice and you fail and you are measured and your performance is made better and better. And then you go to the patient and then you have less errors, less mistakes, less better outcomes at the end. Just by integrating that technology in a smart way. Imagine the power of having haptics in virtual reality. Imagine the power of having a heart or a lung or a brain that is floating in there, and you can touch and you can feel. Imagine you're drilling a bone and you can feel the drill. That's happening. That's already today real. And very soon it's going to be the way we really learn any sort of procedures in a way. Not just in medicine, but any area of human ability.
You're totally right. Technology is progressing at such a fast pace, but the big conversation here is healthcare has been progressing at a little bit slower rate today.
Unfortunately.
And a major theme of that also has been with the application of technology from doctors and patients. So I got to ask you, Doc, what convinced you that this technology was going to help out your surgery?
Well, for years I've been, like I said, a technophile of sorts, and it was actually here in exponential medicine. When the precursor of exponential medicine was future med. Future medicine. Future med was a sort of a short program, about 6-7 days, 80 people, being exposed for all that time to magic technologies, exponential technologies. And one of the technologies I was exposed to was by the inventor of Google Glass back then in 2013, Babak Parviz from Google. And when I saw that technology could do to connect and communicate, having the ability to stream from the perspective of the user, having the ability to Google anything, having the ability to talk to the net and get an answer in front of you, then I saw this is a device that must be used in medicine. So I ended up doing the first operation with Google Glass, and that caused a lot of commotion. That had never been done before. So that actually got me more and more involved in how to really apply these technologies to doing better medicine and to teaching better medicine. And it's been a phenomenal sort of parallel career of sorts. And as a surgeon, as a physician as well, I feel that it's a responsibility for me. It's really my duty to go out there and try to change minds, because as you said, it's very difficult to engage, especially providers, especially physicians, especially administrators, regulators. So the role of someone who is on the trenches, doing surgery full time, who at the same time is, a geek of sorts, a technophile. I think that's a very important role, that I have to go out there. So I've become sort of a keynote speaker, an influencer, an advisor. I tell companies, startups, universities, governments, use me as a resource. I'd love to, because I really feel, for me, is my responsibility. Otherwise, the change is going to happen no matter what, but it's going to be much less exponential and probably slower than it can be.
Right. So that's your role in that as well. What about the patients, though? The patients that you're operating surgery on, are they more comfortable that you're using this device, or are some like, hey man, I want you using those Google glasses on? What are they saying to you?
Well, I think patients, it's interesting. There have been some research done on this, and I think personally, patients want to be helped. They want to be cured.
Right.
And I think that anything that they envision that can make that process more comfortable for them and the result be improved, I think the patients are okay with that. And it's a matter of talking to the patient. Physicians, surgeons, we're educators, not educators of new generations of surgeons only, but educators of the patient. And it's, as leaders in healthcare, we need to be able to engage the patient with all these different, imagine doing robotic surgery in an older patient who has no experience with healthcare, and suddenly you bring that patient to an OR and there's a robotic arm in there, and how do you get the patient to accept that? Well, the patient is happy, the surgery is going to be better, and you tell them, well, this is going to improve me, this is going to augment me. It's not going to be a machine operating you, it's me driving the machine, so I'm a better provider, a better physician, a better surgeon, a better healer if I had this technology helping me. And it's our role to let the patient and make the patient and the families understand that.
So tech will evolve with this trust then, with this trust of technology and surgery, and understanding this more, and education.
Absolutely.
What do you think's coming next then? What technology do you think's coming next that you're excited about, that you want to implement today?
Yeah. Well, I think that you know, we would need weeks of talking to address that. But I'm very excited about the potential of artificial intelligence to systems, you know, to really empower us, to not substitute us, but empower us. You know, it's been said, you know, the physicians who are going to be, or the workers who are going to be displaced are the workers who don't use AI systems. Yeah, I think that's very important. AI is already here, has been for years. It's going to get much better. It's going to be magically, exponentially much better and much more helpful in a real way, and we are not going to even notice that it's there. So AI systems is definitely one of those technologies that is very, very exciting. Along with that, I really think that 5G connectivity, you know, a lot of this technology, you know, is great, but if you have no connectivity, you know, so I think 5G giving us a wider bandwidth and a zero, almost, you know, perceptible latency, you know, delay, is going to enable us to use a device to do, you know, teleconsultations in real time, much better than now. Potentially imagine even remotely operating on a patient, remotely doing a procedure on a patient. It has been done already in China, has been done in the beginning of the year, and it's going to be something that is going to empower us to really, it's almost going to be like a conduit to really bridge the power of technology with the real doing things with that technology. So 5G, I would say, and artificial intelligence are those two things that really are going to. And I already mentioned spatial computing. I think spatial computing, you know, the ability to compute in the space without having to have a phone or a tablet or a watch or a laptop or a PC, even less. That's going to be magical as well.
I'm excited for all those things to come to fruition, and I think we could both agree that it won't happen unless there's some leadership.
Absolutely.
And Doc, you've showed quite some leadership, being one of the first ones to wear Google Glass, augmented surgery, fascinating stuff, and now you're motivated by that, by your role in that, to talk about it, to inspire more, to educate more people about what you can do it. We consider that leadership. So Doc, the last question I'll ask you is, what is your definition of a real leader?
Well, you took the words out of my mouth. I really think a leader is an educator, is an inspirator. I think that our role as leaders in whatever you do is to, you know, guide people to understand what you're trying to do, you know, enable communication and connectivity in a better way. That's what a leader does, I think.
Doc, appreciate you coming on the show. We talked about a lot today. Talked about your involvement in exponential medicine, how it came to be, coming from Venezuela, and then practicing. And you said you were always into tech, and now hoping to inspire others to adopt such technologies to improve the efficiency and help patients overall. Appreciate your time here on the Really Is podcast. For Dr. Rafael Grossmann, I'm Kevin Edwards, asking you to go out there, articulate your vision, and always, folks, keep it real.
Thank you very much. I appreciate it.